Welcome to the first day of our iCON Health Forum. Our theme for this week is going to be Take Charge of Your Health, Dementia 360. Please click on preview if you want to join the forum.
So we would like to acknowledge our iCON office is situated on the traditional ancestral unceded territory of the Musqueam, Squamish, and Skalukut peoples. I would also like to acknowledge that you are joining us today from many places near and far and acknowledge the traditional owners and caretakers of those lands. And there are a few announcements. First,
thank you very much. Thank you. I think that on screen you can, some of the participants have done this before, have joined our activities before, and today I'm just going to make a simple introduction of what iCON is all about. Hopefully that some of the participants will know. So the iCON is one of the projects initiated by the Digital Emergency Medicine of the Faculty of Medicine at the University of British Columbia. The main purpose is to help people in multicultural communities, including Chinese communities, understand how to prevent and self-manage chronic diseases by organizing health seminars, workshops, and using internet technology. We strive to share the most accurate and reliable health information with you. Not only do we hope that local people will actively participate in seminars and other activities, we also hope that the sharing of this health information can be extended to more remote areas and overseas through live webcasts and help everyone work together to improve their health. All right, first of all, I want to introduce from the lead of digital medicine, emergency medicine, and the founder of iCON, Dr. Kendall Ho, to give you a warm welcome. Kendall. All right, Barbara, thank you. Well, everyone, our friends online and the Cafe Nursing Home and the Mineral Community Center, we thank you for your active participation. I am Kendall Ho. I am at UBC. I am one of the professors at the School of Medicine at UBC, and I'm also the executive director of iCON. On behalf of the university and on behalf of the Ministry of Health, I thank you for your participation. And I know that it's been for 2 years that we've had this pandemic, so it's affecting us to the point where we have to do this online. I hope that in the near future we can sit together and then we can actively participate and know each other and know more information. And I know that today we thank you for your active and your enthusiastic support online, and then we can meet on the air. I know that there are some good friends, old friends, and there are also some newcomers, and thank you for your participation. I hope that today this subject on the talk of dementia, we can get some insights into this issue. We also thank many media partners. They help to promote this forum, and they're also exhibitors, health exhibitors, like Barbara said just now. Those you can visit within the next month. So every time after we have spoken, we will introduce 1 or 2 exhibitors to you. And we also are very thankful for the community partners. Today, I'm not able to thank them all, so I'm not going to thank them one by one. I'm very happy that at this point in time, I know that there are many. Today, our theme is about managing health, Dementia 360. So you can tell that we hope that we can offer a series of topics on this theme to give you more insight into this issue. And there are so many things that we're going to cover today and tomorrow. For today, we want to recognize what dementia is, and what the symptoms are, and how the importance of early detection, and when you will need to seek help, and how to treat them, how to treat it, what are the medications to treat it, and how to how to interact with patients with dementia. And for tomorrow, there is another part of this. We're going to talk about nutrition for dementia patients and their mental health, as well as their home safety, as well as their long-term care. So when the patient will need to go into long-term care, and also other care aspects, which we will leave for tomorrow. To Dr. Ho again.
Okay, thank you, Barbara. So immediately I will introduce Charmaine Ma. She is a very good general practitioner and who is very good at diagnosing. I think she would get to explain a few things. So how we know the difference between normal aging and dementia. So sometimes I might have forgotten my glasses, and then I may forget things. So would that be dementia? And also how to recognize early symptoms of dementia, so that we can know the importance of early diagnosis. And also what factors would increase the risk of dementia, so what are ways for us to increase our help. So thank you, Dr. Ma. So we are going to listen to your presentation right away. So I'm Dr. Ma. Thank you so much. Thank you for your introduction. So I'm very honored today to come today to share medical knowledge. I'm Charmaine Ma. I'm a registered family practitioner. And I hope that you will not forget the main topic. Today's topic is dementia. So actually what is dementia is actually a general term, but explaining that there is some changes in the nerves in our brain, and then it would go through aging faster than normal people, affecting our life and our function. So without further delay, I would like to talk about what are normal aging and then what is dementia. As a family doctor, many people would come to me and say, oh, sometimes I forget my keys. Sometimes I forget to bring my phone. Would that be dementia? But that is normal aging. So today, when we are getting older, so of course, then with certain age, then just like engines, we are going to wear and tear. And normal aging, well, occasion forgetfulness is kind of normal. For example, talking about past events for over a year or things for a significant time, then I think that is forgetting that is normal. And sometimes I might get lost occasionally. So sometimes we may not be going out for a meal for a long time. And then when I'm driving, we may have forgotten which turn we should make. So that is normal aging. However, if we find that our memory is getting worse, and even some very recent events we may forget, like just yesterday, whether I had a meal or whether I had my shower, or just last week, I saw a friend, but I have forgotten that. And also getting lost at places that you are familiar with. For example, a supermarket that you know of, and then it seems that you get lost. And then for some of my patients who've been here in Canada for many years, and sometimes you may forget which door is to the exit, so that may be symptoms of dementia. And also there are some unhappiness in life, which is very frequent, and that would affect our moods, and so that our moods will fluctuate. But from day to day, our moods should be stable. However, because of dementia, we may not have a good grasp of the time or the memory of events. Therefore, sometimes we may have unstable emotions. And some people would feel scared. Some people feel angry. and some people may have a depression. And for most people, as we grow older, and we seem to be still very smart, and our conversation usually would be very clear. However, if you find that the conversation or even the speech is slurred, it seems that the ability of understanding and comprehension is affected. And these are some of the symptoms of dementia. And after all, on the whole, there are many things that can affect our everyday life. For example, shopping, financial management, and then as we get older, and most of these things we should be able to deal with. However, dementia would be affecting our everyday lives. So the next one we're looking at, we try to look at early symptoms. For early symptoms, so people may say, if it is really early, how can I differentiate whether it's dementia or some other symptoms? So first of all, when we talk about worsening of memory, so personally, the person may not feel it. So usually it would be people around us, friends or family. So for example, if you find that your family member seems to be forgetful and also losing the way in very familiar environments, then you should pay attention to it. And I would like to remind family and friends and try to raise the concern in loving care and concern. And if you hear people reminding you, then don't just try to hide away from the doctor. You try to approach it as soon as possible. And also the worsening of planning capabilities, for example, shopping, everyday lives, managing your daily life. If that seems to be problematic, that could be early symptoms. And also for everyday self-managing care, like eating or bathing, so then you should approach the family doctor. And talking about speech, if you find that the comprehension power or expression power is getting worse, then you should be paying attention. And we also talk about emotions. Some people would feel that very obviously. And because you have poorer memory, then that will affect your emotion, being fearful, angry, sadness, or even depressed. And also we mentioned in familiar places, you may get lost. And well, if you're among familiar people walking with family and friends, then you may not notice it. However, when you are on your own, then you get lost easily. That could also be early symptoms. Okay, and let's talk about the importance of early testing. As a family doctor, so my duty is to exclude other reasons. The reason why we have primary care, sometimes we would try to assess for the patients, because when you have discomfort and you come to the family doctor, we would ask you a bunch of questions and give you physical examinations. And then we can sometimes confirm that memory loss could be of other physical problems. For example, lack of vitamins. Some people would be lacking thyroid, and or some sleep problems will also affect memory. So whether you are depression or whether you are under the influence of alcohol or medicine, so that could also be affecting your memory. So it is good to bring it up with your family doctor as soon as possible. Another thing elderly persons should pay attention to would be your hearing or visual problems. If you do not hear well, then you might be misunderstood to have comprehensive issues. And if your vision is not good, then you may not see street signs and you get lost more easily, but not because of memory. And if we can have diagnosis of other health issues, then we can have active participation in your personal decisions. For example, including your healthcare and maintaining your health. There will be other specialists and pharmacists who can suggest other methods for treatments. And also, treatment takes time, so do not wait until the very last part of the illness and then to take care of it. So if you take care of it sooner, there will be more choices. And the importance of early testing, then you can set your goals more easily, like when should I be retiring, or should I be taking more trips? And also setting important decisions like legal or finance or healthcare decisions. So of course, these should be done as soon as possible. And therefore you can seek for support from other professionals like doctors, so that these could be done after early diagnosis, and then you can have more choices. And also you can also encourage other people too. You can promote research and things like those. The next one, we're talking about risk factors. Now, if you have taken part in previous iCON seminars, there are different age factors. There are some factors that are not changeable, and there are some changeable factors. And in this case, unchangeable factors will be our age. We discovered that people over 65, so maybe after 5 years or so, then the risk factor of having dementia will be higher. So for sure, age is a risk factor, but we cannot change it. The next one is about the genes. Although many people come in and say, oh, my immediate family or my extended families have dementias. That doesn't mean necessarily I will have it. So no, not necessarily. So just don't be afraid and just say to yourself that, oh, I'm doomed to have dementia. No, that is not the attitude. You should talk about this with your doctor. So to find out whether that genetic comes in play in your situation. So next, we can look at some changeable factors. There are some things that we can take charge of. As a family doctor, yes, I am nagging, I'm repeating. So I keep telling people that you should have a balanced diet and do healthy exercises. So when we talk about exercise, people will say, how much should I do? That is enough. In BC, health guide, there would be recommendations. So if you don't have restrictions, then there should be 150 minutes of exercise in a week. It sounds a lot, right? But what is the concept? If you split it up every day doing a little bit, then if you do 5 days a week, then every day you only have to approach 30 minutes. You don't even have to do 30 minutes in one lot. Say in the morning when you find that weather is good, then you can go out and have a 10 minutes walk. And in the afternoon, when you feel like it, then you can also go have a walk, do some dancing, do some swimming. And then these all come into play into the 150 minutes in the week. And tomorrow, we are going to have a dietitian to share about tips on balanced diets. We discovered that some vitamin like vitamin D or B plus or folate. So if we are lacking any of those, that would also affect our brain health. And of course, there will be the 3 high or this smoking or alcohol. Because of the high blood pressure, high blood glucose, or blood cholesterol, they will all be affected. Just like the water pipes in our home, if they have been used for a long time, then there will be some blockages. And therefore, if those blood vessels go into our brain and they are blocked, then of course that will affect our brain. And we also find that there is traumatic brain injury. For example, boxers or athletes who were more prone to have head injuries, then when they age, the risk factor of having dementia would be significantly higher. So therefore, some sports association, they are more stringent these days. Because even when young children have traumatic injury to the head, then there may be a further risk factor, and therefore they are trying to keep safety to a higher standard. The next one is about sleeping issues. If there is lack of sleep, then it will promote the deterioration of dementia. And nowadays, doctors are not prescribing sleeping pills a lot because some people may feel drowsy and that may affect your mood as well. And the next one, we are going to look at when to seek for help. When are we going to see the doctor? When are we going to see other professionals? So if you find yourself or those that you care that their habits, their speech, or their emotions seems to have a lot of change, then accompany them to the family doctor or even other specialists like nurses, pharmacists, to see whether they have professional suggestions so that you can have something to deal with it. And then when you discovered that the daily lives are being affected, that certainly will be a time to seek for help. And also, if you find that there are problems with care, and I think it is a good time to seek for help as well as to express your concern. And today, I know a lot of families are joining us. And if you care for your own health and you care for the health of those who are around you, and if you want to learn more, or you would want to search for more support, then you should take the first step and then to seek more information. Here, I would like to introduce some references. I know most people, before coming to the doctor, they would say, oh, doctor, you don't have to say as much. I have already come across a doctor who is more approachable, who is Dr. Google's. So some people, I tell them, don't go onto the website in the middle of the night and then look for those websites, because usually when they come to the doctor, they will be very scared because they have read all those possible symptoms. So I have listed some possible steps, and I know that there is a recording as well as video recording. And I hope that you can find time to find what resources that you can find in the province of BC. And thank you so much to come to this forum to take care of your health. Thank you. So thank you, Dr. Ma. There is a lot of...
Now, I want to thank all the speakers of today. And there are also many community partners who have supported our activities. And I want to thank the Ministry of Health of BCA Patients as Partners initiative, this project to support our work. And our community as partners, there's so many partners: Mosaic, Canadian Mental Health Association, Alzheimer's Society of British Columbia, Diversity Self-Management, South Vancouver Neighborhood House, Family Caregivers of British Columbia, and RCMRG. So, and also media partners who sponsor and support our activities so that we can have such a huge audience to join us in today's forum. Thank you very much. And finally, we thank our exhibitors, our health exhibitors. Right. First of all, I want to thank the health exhibitors. What I want to tell everyone is that there's going to be a month-long exhibition there. For example, our Alzheimer's Society of British Columbia and the Canadian Mental Health Association, as well as Success and South Vancouver Neighborhood House and Richmond Gives family caregivers of British Columbia and diversity, and our own iCON network will also display information there for 1 whole month. We also want to thank Richmond Cares, Richmond Gifts, who in our community center has a viewing party, and also want to thank Cathay for hosting a viewing party. For now, that's all for today, and I will thank you in English. So remember, tomorrow, 2 p.m., we are going to continue our talks on different topics. And tomorrow, we're going to talk about nutritional knowledge on dementia, our nutritionist, Jojo, and the mental health of patients as well as their caregivers, Dr. Tigerson Young, I'm sure you know him well, and also safety and long-term care. And we have Wendy to host this talk. You're all familiar with her. She's a registered occupational therapist. So I hope that everyone will join us again at 2 p.m. tomorrow on air, and we will share a lot more information with you. So hopefully we'll see you again tomorrow. That's it for now. See you tomorrow.